The aim of a hemodialysis diet that I prescribe to you as a dietitian is to help you limit the buildup of waste such as potassium, sodium, phosphate, urea, and other salts. Limiting buildup of waste in the blood will help you prevent metabolic complications such as renal bone disease or hyperkalemia, a situation where there is a rise in levels of potassium in the blood. So one strategy of reducing this waste buildup is adapting healthy cooking methods. In my last episode on hemodialysis, I promised that I will do a video on food preparation or cooking methods for patients who are on hemodialysis or any dialysis. So today I'm here just to give you tips on that. So join me until the end of this episode. If you're new to this channel, why are you not subscribing? I bring so many topics related to health and I will wish you not to miss out on any. So feel free to take your notes. My name is Jemima Egesa, clinical nutritionist or dietitian, and thank you for joining me. If your dietitian has advised you to reduce your salt intake, and that is, I'm talking about less than 2000 milligrams per day, that's like 4 to 5 grams of sodium chloride per day, you will be required to cook your meals at home. That is, avoid it out. During your cooking, you are advised to use low sodium condiments, avoid salt, that is, no adding of salt in your foods. You can add herbs, spices, vinegar, lemon, just to bring up that taste. Avoid processed stuff or foods or any cured foods, but because they usually contain high amount of added sodium. During hemodialysis, there is always increased amount of nutrient requirements, especially protein requirements. But you find that most of the food sources that contain high biological protein, they also have high amount of phosphorus levels. So one way of reducing phosphorus levels in your foods there at home, for example, when you want to enjoy your meat well, you can soak it, cut, and then boil it of course, in a large amount of water. And after boiling, you discard the liquid that you've used to cook the meat. So in that way, phosphorus levels are leaching in that liquid, and you're reducing the phosphorus levels in your meat, so you can be able to enjoy it safely without worrying about the symptoms that come with high amount of phosphorus levels in the blood. Again, we've talked about reading your nutritional labels when you're shopping for these processed foods there in your food stores or your supermarkets. It will help you identify any food product that has added phosphorus additives, because phosphorus additives interfere with the way your phosphate binders will function. An example of a phosphorus additive like calcium phosphate, phosphoric acid, disodium phosphate in things like your yogurt or your dairy products. So read the labels, identify those foods that do not have those additives, or just eat your fresh foods. Cook your fresh food meals there at home. It will save you all the headache. The final tip I'm giving today is on how to reduce your potassium levels in your foods, because we want to maintain a steady heartbeat and avoid any heart complications. So tips I'm going to give on this include on how to prepare your vegetables that may contain some considerable amount of potassium levels, and also I'm going to talk about how to prepare your legumes before cooking. Step 1. Peel your vegetables well and place them in cold water so that they don't darken. Okay. Step 2. Slice or cut your vegetables an 1/8 inch thick. Now, step 3. After cutting it, you rinse it in warm water for a few seconds. Then soak the vegetables in warm water again for at least 2 hours. Now, the amount of water you're going to use to soak should be higher than the vegetables itself. The ratio of water to vegetables should be like 10:1. If you're going to soak them for more than 2 hours, you're required to replace the water every 4 hours. Quite tiresome. So you've soaked them, and now it's time to cook. Rinse them again under warm water for a few seconds, and then boil them in the water, in large amount of water. The amount of water you're going to use to cook the vegetables should be 5 times higher than the amount of vegetables you're cooking. Just that simple. After cooking, you will drain the excess amount of water, stir fry your vegetables well, and enjoy. Do not add any salt. You can add your herbs, your vinegar, your lemon to bring that taste. For legumes, again, the same process. You will soak the legumes. These ones include the beans, the chickpeas, the lentils overnight. Wake up, discard the water, wash them well with fresh water, and then again boil. So thank you again for joining me until the end of this episode. I hope you've learned something. If you're a dialysis patient, we are with you to support you in your journey. Kindly enjoy your meals well, consult your dietitian. If you have any symptoms like anorexia,